Nurses protested outside the Palliser Regional Care Center in Swift Current on Thursday. They were upset because they were told they could not have SEIU West representation at a gathering that was supposed to discuss the elimination of 12-hour shifts in long-term care facilities in the region. SEIU West representative Barbara Wotherspoon says there was an issue with communication.
They told me I couldn't be there. It was a staff meeting. I said, no, it isn't. It's advertised as a presentation on 8 hours.
Officials with the health region say this wasn't the right way to handle the situation.
As a health region, we were disappointed that our staff chose that opportunity rather than to meet with us to, in fact, have a rally in our facility that, in fact, was quite disruptive to our residents.
This whole issue stems back to July when the region informed nursing staff that they would only be offering 8-hour shifts. The region says their decision to eliminate the 12-hour shift is based solely on patient care. But SEIU West isn't satisfied with this explanation.
They haven't got one fact to prove that, and we've asked them. Give us some facilities, Herbert and let's say East End have the 8 hours. They've never wanted the 12s. We've never bargained a 12-hour shift agreement. We need comparisons as to the absenteeism of a 12-hour shift.
Nursing staff and clients outside the care center on Thursday also expressed their concern about the shift changes.
Working 12-hour shifts, working nights. I work 2 to 3 nights usually in a row. With the new roster, we'll be working 4 to 7 nights. You don't think that that's going to affect us mentally, physically?
We're fighting for our lives and our families' lives. Right. It's not just us.
My dream was to get a 12 down the road, and I'm just working on an 8, and it's terrible.
We continue to write letters. We continue to voice our opinions. They say we're not being respectful, but nobody has once been disrespectful.
There's been a lot of stress and tension going on with the talk of going back to the 8-hour shifts. So I'm definitely not in favor of it.
After hearing some of these concerns, Vachon says the region is still going forward with their decision.
They are definitely acknowledging that it is going to be impacting on their lifestyle, and we do appreciate that. However, we're in the business of providing health care, and we need to always be looking at how we do that the best way that we can. And we believe at this point that this will allow us some flexibility and how we utilize our staff more effectively to provide that care.
This is a regional decision, and the reduction in hours will be implemented on November 7th. The 3 care centers in Swift Current, along with the long-term care facilities in Cabri and Gull Lake, will be affected. For Southwest TV News, I'm Kara Rapke.